So everyone has been talking about the Inflation Reduction Act of 2022. In this video, I'm going to be diving into the catastrophic results of what it's going to cost you, why you should be worried about it, and all the implemented changes that are going to take full effect as of January 1st of 2025. Stick around. We're going to be diving into the details of this Inflation Reduction Act and everything you need to know in this upcoming video. Most seniors, when this came into effect in 2022, it had some implications that were good. And now as we push into the year 2025, when it's going to go into full effect and all the processes of the act are going to go into effect January 1st of 2025, you need to stick around. I'm going to be diving into breaking down the Inflation Reduction Act, the things that are good, but also the catastrophic things that are going to occur to a lot of seniors that are not aware of what's going on and exactly how it's going to increase the cost, premiums, and all types of implications because the act was signed into Congress. So there's always with a good, there's always a bad. And in this situation, the Inflation Reduction Act, if you don't understand it, you need to be aware of it and you need to be watching some very important details as it comes out in the fall of the year in September. You're going to get your ANOC, the Annual Notice of Change, and that's going to go over the changes for your prescription drug coverage. If you have a Medicare Advantage prescription drug plan, they call it Medicare Part C or Medicare Advantage. Typically, it's an HMO or PPO plan. If that's what you're enrolled into, there's nothing wrong with that. There's typically with that a drug benefit, and you need to be very aware of what's happened to the drug cost, your formulary, a lot of moving parts there that we're going to cover in this video and a couple of other videos that we're going to associate with this series. And then also if you're on a Medicare prescription drug plan, let's say you have a Medicare supplement and then a drug benefit, there's going to be some major potential changes and some things that we're going to cover in this video as well. So let's dive into trying to answer whether or not this is great legislation or not so great. The potential for high premiums and reduced plan options is really the main thing. All the videos that I'm going to be talking about is going to really expose and talk about. There is going to be a potential for very high premiums and sadly reduced plan options, and you need to be aware of that and what to look for. We're going to be covering that more and more as we go into the details. Stick around just for a second. I'll be right back. We're going to dive into exactly what happened in 2022 when this act first went in, the pluses of benefits and things that changed. You may have been aware or impacted by these. Some of them were good. And then we're going to build for each year, 2022, 2023, 2024, and then 2025 and what the changes are. Stick around. I'll be back and cover the 2022 in just a second. So guys, in this next video, I'm going to be going over the changes in 2023. And just a reminder, when insulin cost caps became a thing in 2022 and went to January 1st, 2023, health plans or prescription drug plan formularies got to choose whether or not they were going to be a part of that program. One of the pushing indicators for 2025 and 2024 is that all drug formularies had to participate. They had kind of a staging process. So stick around. I'm going to be covering the insulin cost gap and some changes for 2023, and then also some Part B information that's very important and vital for you to know about what happened in 2023. I'll be back on our next video and we'll cover that information as well.